The new approach was announced in mid-August, but patients have to meet certain criteria such as be asymptomatic, willing to impose self-isolation at home, not have any other health complications, and not be elderly. People are worried about such an approach, however. Keeping such a person at home raises concerns that he or she could infect others at their house. I therefore propose that they be taken to treatment centers to protect others that have not been yet infected in such homes. If such people were to break the self-isolation protocol, they would only help spread the virus fast, pushing it to a level at which it cannot be stopped. We could find ourselves in a situation similar to Italy's or India, countries where the infection rate is extremely high. Health officials are, however, assuring people and stressing that a one-month test run provided good results. The month passed and the figures gave us confidence. Those treated in that way commended the approach, so did the doctors, and even the critically ill benefited. A person terribly sick needs 10 doctors to attend to them. Think then how many doctors it would take to treat 100 critically ill patients. You saw some of the patients that were not really that sick sitting around and even playing football at treatment centers. Really, a person like that should be treated elsewhere in isolation so that they are not a threat to their neighbors, and we tried it getting good results. Let me give you the figures. We started treating 203 people at home during that month, and so far, 46 have fully recovered. The first test runs of the approach were held in Rusizi district in Rwanda's western province, a district with 30% of all the country's COVID-19 cases, and local health councillors there that helped implement it have also given their approval concerning its effectiveness. Health officials in the country have also, however, continued to express concerns about the speed at which the virus has continued to spread, with the number of patients being treated by doctors more than doubling between the end of July and the 29th of this month of August, from 911 to 1,923. Hence the need for new treatment approaches, not forgetting that there could be people that have the virus and don't even know it, spreading it around. People should not be worried about those being treated at home because they are known and have directives and guidelines they follow, and we know where they live, have tested them and so on. So I do not think they are in a position to spread the virus. I am, however, worried about those carrying the virus and moving about in markets, in vehicles and so on, and they could be many. Health officials in Rwanda say between 70 and 80% of all COVID-19 cases could be asymptomatic, which is why people should not simply assume that a person is not sick because they do not show the symptoms.